Your first question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Hi, Brian.
Hi, Premier. I'm wondering if you can respond to criticisms of the lockdown, the 28-day closure of restaurants and so on by Mark McEwan. He's saying that they are not working, that it is detrimental to the industry, and he's saying that you should be brave and lead Ontario back to work.
Well, thanks for the question. I have a great deal of respect for Mark McEwan. He's a great entrepreneur, one of the great restaurant owners, and unfortunately, Mark's not a medical professional. He's a business owner. I understand that. He gets it. But I have to listen to the health professionals, and we see the numbers going up, and we're concerned about that. We're over 800 cases. There's only 5 regions. We're down to only 5 regions in the entire province that don't have any cases. That's telling me it's spreading right across the province, which is concerning. But in saying that, I respect what he's saying. But again, we have to focus on the health and the safety of everyone across the province. And maybe I'll have the Minister of Health talk as well.
Well, I certainly understand Mr. McEwan's frustration. He is a great restaurateur and entrepreneur, but what we have to look at and listen to is the scientific clinical evidence, and we've been advised by our public health measures table by Dr. Williams and his team that these are measures that we need to take in order to stop the community spread of COVID-19. There are some economic points of assistance that we will be providing, but for this time period we need to make sure, because we know there is community transmission that is happening from some restaurants and bars, that we need to have this lockdown in those areas for the next 28 days. The idea is that this will flatten the curve, bring the numbers down to a more manageable level, not overwhelm our hospitals. And the evidence also says that if you take these steps now, that it prevents us from having to go into a longer period of lockdown with more economic shutdowns. So while we recognize this is very difficult for many business owners, this is the advice we've received from the medical professionals, the public health professionals, that this is something that we need to do right now.
Follow up.
The 28-day period, Quebec admitted yesterday that theirs will not end, that it will go past 28 days. Mm-hmm. I'm wondering what the plan is beyond rotating lockdowns. You know, if we stay in this 700 to 800 case window, do we just stay in this modified stage 2? Do we come out of it and then go back into it in a few weeks? Is there something that the province can look at doing other than continually shutting down specific businesses?
Well, thanks, Brian, for that. And trust me, when I say I hate shutting anything down, I hate shutting it down. Absolutely hate it. I understand what it takes to meet a payroll, take care of a business. I absolutely despise it. But I've said right from the get-go, I'm always going to listen to the health professionals, and I'm going to continue listening to them. We have to have a happy balance of the health and the economic health of people. And you know, I always say to our health team, how do you measure depression when someone loses their business or loses everything they have? How do you measure that? It's very, very tough. How do you measure mental health? That plays a role in it. And I've made it very clear to the health table that they have to take that into consideration. I truly believe they do. I've always said, I believe Dr. Williams has been very pragmatic. Dr. Brown's been very pragmatic. The whole health team has. They take that seriously as well. As they give us the health advice, that the number one priority, we won't even have an economy if this thing just continues to spread and gets up over 1,000 cases. And I'll give you an example. Take a look what's happening in Alberta. I have a great deal of respect for Jason Kenney. Matter of fact, he's one of my closest allies, a great leader out in Alberta, a great premier. But you're seeing the numbers skyrocket. And if you do it per capita, it's probably up to close to 1,500 cases happening. So I just want to make sure we keep our hands around this and do everything we can with balancing the economy as well. It's not easy, I'll tell you. But the last thing I want to do, Brian, is close places down. I really don't want to do that, but I'll listen to the health professionals.
Next question.